Dr. Eswaran, I was wondering if you might be able to share some of the common symptoms of IBS and maybe expand a bit outside of just the pain and the changes in the bowel habits.
Right. So, the most common symptom and the criteria for irritable bowel syndrome is that you need to have both abdominal pain and change in your bowel habit. But it is definitely more complex than that. So, the abdominal pain that patients describe can really be very different in different locations and character. Some people will describe sharp, burning, achy, gnawing, all types of different type of pain and location. So, some patients really say, oh, my IBS pain is always in the left side. And some patients, it really kind of migrates. But one of the hallmarks is that you have pain that is associated with a change in your bowels. So whether or not you have diarrhea or constipation or a mix of both, the pain often mirrors that or kind of goes along with changes in the bowel habit. There's also a lot of other symptoms that patients will describe in addition to their pain and change in bowel form. So, for example, many of our patients really report a lot of bloating or abdominal distension. Sometimes patients describe that as gassy or flatulence, and that often will change and increase with eating or fasting or particular foods. And we can talk about that. There's also a lot of fatigue that patients will describe, and we're not really sure why that happens. Also, patients will discuss a passage of mucus in their stools, which can be uncomfortable and disconcerting.